This is Dr. Eric Fishman with Steve Aylward, General Manager for Healthcare and Life Sciences for Microsoft. And Steve, can you tell us a bit about Microsoft's got a significant involvement in the healthcare industry at this point in time? And start maybe at a high level, and then we'll drill down to some of the more intimate details.
Sure, I'd be happy to, Eric. Really, when you look at our presence over the last number of years, we've really gone from kind of a niche player within the health space to covering really not just physicians and hospitals, but also health plans and life sciences, as well as the consumer environment. When you think about it, I think all of us got into healthcare in one manner, shape, or form for really one reason, which was to improve health for our patients and really to improve care across the globe. And in my prior occupation, I didn't really think I had as much of an opportunity to do that, where it was specifically directed at, let's say, at a provider level. Now, with the opportunity to have this role and responsibility at Microsoft, the ability to really see how providers and plans and life sciences and consumers all need to share information, I think we'd all agree that while there are many areas that need improvement, being able to share that information across those different environments is one of the areas clearly where Microsoft can contribute, and I think we're starting to have that impact.
You know a bit about that. Now, we're at the Allscripts client experience, and tell us about the relationship between Microsoft and Allscripts, if you would.
So Allscripts is one of the really early software vendors, if you will, as we refer to them as independent software vendors, who's developed the vast majority of their solutions using Microsoft products. So one of the first things that they did coming out of the blocks was to endorse Windows Mobile as an example on a cell phone, to be able to support that as a platform and have that roll out to end users, whether they be physicians or clinicians of any stripe.
I don't know, not to interrupt, but I don't know if you were in the keynote speech yesterday, but when Glenn Tolman mentioned that in the near future they would have Allscripts Remote available for Windows Mobile,
right,
there's quite a lot of applause in the audience.
Yeah, and I saw Stanley demonstrating to you earlier what was being done with Windows Mobile. That's just one.
It's not to interrupt, but a lot of interest in that particular area.
It's phenomenal. I mean, you think about how the form factors are changing in terms of how all of us, but particularly patients, access or can access their health information. It's not just about the computer anymore. It's about smaller form factors like handhelds, like a cell phone, which Windows Mobile runs on, or a television, or what we showed in one of our breakout sessions, like a Surface device that would be think of a kiosk, but in a coffee table format that has full touchscreen capabilities that could download information from a personalized health record, as an example, and could be shared with other family members or a physician.
And so let's talk about the Microsoft PHR Health Vault. Tell us about how it's been progressing, if it's going according to schedule, and what the vision is for the next year or two.
Okay. There are a number of things going on in Health Vault. There are initiatives both in the U.S. and then worldwide, Eric, that I think it's kind of important to make that distinction. In the U.S., the Health Vault model is one where we're not charging anybody for access to either develop solutions for Health Vault or to be able to use it. It's free to the end customer as well. The business model there is really advertising driven from the website, so that when you go on our search engine, such as Bing as an example, and you look at health information, the idea is that's generating revenue through ads that people would click on, given whatever information it is that they're looking for. The rest of the world, however, we think there's a real model for Health Vault to become a personalized health record, specifically at an individual basis, and many governments are being able to look at the opportunity of using Health Vault plus other technologies to be able to make that available to their citizens. And we think Health Vault can have a role in that. TELUS recently, the telecom organization up in Canada, is sponsoring Health Vault for Canadian citizens to do exactly that. That was the first such announcement that was made just a few months back.
Is it public information how many patients are using Health Vault at this point in time?
It's not. We still have really kept it not so much at the consumer level. We're really gearing up to the point where we're signing up partners to be able to deliver applications and develop applications out to consumers. So it's really a partner play for us at this point, not so much from a consumer standpoint, but anybody can go on healthvault.com and create an account and begin to play with it.
Can you tell us about some of the functionality that the partners are adding to it?
Yeah, so primarily right now, really the first thing that we started with was the capability to do medical device integration. So if you think of patients with chronic diseases like diabetes is probably a good example. The issues of trying to store glucose levels and share those glucose levels with the physician at different times a day, it's pretty easy to transpose characters and misinterpret information. The idea is through a device like a glucometer.
And these are downloaded
that
automatically.
could download right into your Health Vault account. So you can download it through simple USB connection to a PC. Some are RFID enabled, radio frequency ID enabled. There's a number of ways that the data can get there, but the idea is electronically downloaded.
And it's available accurately in real time to the physicians.
Accurately in real time, correct. And then you can enable any end users, whether you're in my case, my wife has access to my Health Vault account, so she can see data relative to me. So when she wants
Hope she doesn't need it.
Well, when she wants to check and see what my cholesterol levels are doing, she can see that from my last lab test, as my physician will send those lab results directly into my Health Vault account. So that's all available today. But the real focus has been applications that have been developed for Health Vault, as well as device integration.
Steve, it's an interesting time to be doing this. What else do you expect to be happening for Microsoft in the next year or two?
It's funny. I think most people at a let's call it a layman perspective who are outside of technology, and even maybe many in technology, don't really associate Microsoft and healthcare together.
That's true, but I think that's in the past, maybe not in the future.
Well, I think it's been said by our CEO Steve Ballmer a number of times that the three biggest bets that we're making in the near term as a company are around our search, our Bing launch that we just did last month, around cloud computing, being able to host applications on behalf of our customers, and then specifically called out healthcare as the major vertical that we're investing in.
I'm happy to hear that.
There's obvious reasons for that. I mean, you look here at the ACE conference, we've got 3,000 people. I've been in the healthcare industry for about 16 years now, and that's the largest user conference I've seen. There's obviously a lot of buzz around what Allscripts is doing, hopefully a little bit about what we're doing with Allscripts, but I think moreover it's just interest from the physician community in terms of their ability and need to get access to information of how they can adopt personalized health records and electronic medical records.
Whether you want to call it 19 billion or 35 billion,
pick your number.
At least if you're not in Washington, that's a lot of money.
Right. Yeah,
Anything else that you'd like to add?
I think it's an enormous opportunity that we just had to share with a number of folks in a breakout of some of the kind of unique ways that we're implementing technology. I know I mentioned Bing a couple times, but I'd encourage people to go on Bing.com and do a health-related search. Just go out and check diabetes, go check hypertension, and see the differences that you may notice. Specifically in Bing versus other search engines.
And the little plug, I look at the people who are landing on EHRtv, and there's a substantial number of people searching at Bing.
Interesting. That's great to hear. But it's a huge opportunity for us, I think, to really improve the way that health's delivered in this country and in the world, which is why we're doing it. But there's also just an incredible opportunity for us as more technology gets deployed, more physicians get off of paper and get onto an electronic record, that ideally it drives a lot of our solutions as well. And that's what we're here at ACE sharing with everyone.
Steve, thank you.
Eric, thank you very much.
Appreciate it.
Thanks.